If modern medicine didn't exist, what do you think you would have died from? It might not have been from some rare disease. It could simply have been an infection. Today, these issues are often treatable. In the past, they were a completely different story. One of the most common ways people could die in the past was from something that sounds pretty ordinary today, an infection. It could start with a cut, an infected tooth, a wound that wouldn't heal, or even an animal bite. Today, if an infection starts getting worse, doctors can clean the wound, identify what's causing the problem, and use antibiotics when they're needed. But before antibiotics became widely available, doctors had far fewer ways to stop a bacterial infection once it began spreading. And that was the dangerous part. An infection that started in one small area could move deeper into the body, enter the bloodstream, and become life-threatening. There were several answers like this in the Reddit thread. One person said an infected tooth might have been enough to kill them. That's probably one of the biggest differences between then and now. Today, an infection might mean a doctor's visit and a prescription. In the past, sometimes the body just had to fight it on its own. And if it couldn't, something that started very small could become very serious. Another problem that feels much less frightening today is appendicitis. If you get severe pain in the lower right side of your abdomen, doctors can run tests, figure out what's going on, and remove the appendix before things get worse. The surgery is so common now that most people don't think of appendicitis as something especially deadly. But that wasn't always the case. If the appendix becomes badly inflamed and eventually ruptures, bacteria can spill into the abdomen and cause a serious infection. Without modern surgery, anesthesia, antibiotics, and hospital care, there wasn't nearly as much doctors could do once that happened. The person who started the Reddit thread actually had this happen when they were only 14. Their appendix ruptured, they got medical treatment, and they survived. Today, that story ends with a hospital stay and probably a scar. In another time, it might have ended at 14. And that's what makes appendicitis such a good example. The human body didn't suddenly become less vulnerable. We just became much better at fixing the problem before it became fatal. Childbirth is another one that's easy to underestimate today. Most births go well, and when something does go wrong, there are usually doctors, nurses, medication, blood transfusions, and emergency surgery available within minutes. But before modern obstetric care, childbirth could become dangerous very quickly. A baby could be in the wrong position, labor could go on for too long, the mother could develop a serious infection or start losing too much blood. And if there was a complication that required a C-section, there simply wasn't the same safe option we have today. That came up several times in the Reddit thread. Some people said they needed an emergency C-section, others mentioned heavy bleeding or complications during pregnancy that required immediate medical care. And in cases like those, modern medicine may have saved two lives at once, the mothers and the babies. Today, a difficult birth can become a story a family tells years later. In the past, the exact same complication could have had a very different ending. Breathing problems are another good example of how much modern medicine has changed the odds. Take asthma. Today, someone having an asthma attack might use an inhaler, a nebulizer, or go to the emergency room if it gets serious. But without those treatments, a bad asthma attack could become dangerous very quickly. The same goes for pneumonia. Today, doctors can use oxygen, antibiotics when the infection is bacterial, and hospital care if someone is struggling to breathe. In the past, there were far fewer options. If your lungs became badly infected, sometimes all doctors could really do was wait and hope your body was strong enough to recover. One person in the Reddit thread described having a severe asthma attack while they were sleeping and needing an inhaler to get their breathing under control. And that's what makes this category so easy to overlook. An inhaler is small enough to fit in your pocket, but for some people, that little device can be the difference between a bad night and a medical emergency. Something we carry around without thinking about can completely change how a story ends. Childhood used to be much more dangerous than it is today. A lot of illnesses that most parents now expect their kids to recover from could once become serious very quickly. Things like pneumonia, whooping cough, severe diarrhea, or bacterial infections were especially dangerous for young children. And one of the biggest reasons was simple. Kids can get worse fast. A high fever, trouble breathing, or severe dehydration can become a real emergency in a short amount of time. Today, doctors can give fluids, oxygen, antibiotics when they're needed, and vaccines can prevent many serious infections before they happen at all. In the past, families had far fewer options. If a child became seriously sick, sometimes the only thing anyone could do was keep them comfortable and hope they recovered. There were people in the Reddit thread who mentioned surviving serious illnesses when they were very young. And that adds another strange layer to this question. For some people, modern medicine didn't save them as adults. It saved them before they were even old enough to remember being sick. So if you've ever wondered how different your life would be without modern medicine, there's a chance the answer goes all the way back to childhood. Some diseases are different because modern medicine doesn't necessarily cure them. It simply makes it possible to live with them. Type 1 diabetes is a good example. People with type 1 diabetes need insulin because their bodies can't produce enough of it on their own. Today, insulin is something millions of people use as part of everyday life. They check their blood sugar, take insulin, adjust what they eat, and keep going. But before insulin became available, type 1 diabetes was a very different diagnosis. There was no real way to replace what the body was missing. Without treatment, blood sugar could rise to dangerous levels, and the condition could become fatal. One person in the Reddit thread mentioned this directly. Without insulin, they probably wouldn't have survived for very long. And diabetes isn't the only example. There are people today living with heart conditions, epilepsy, blood clotting problems, and other illnesses because medication keeps those conditions under control. That's another major change modern medicine has given us. Sometimes it doesn't remove the disease. It just turns something that could have ended your life into something you manage as part of it.